Hello, everybody. I'm Dr. Anjali Agarwal. I'm a consultant physiotherapist, a lifestyle consultant, a women's health specialist, and also the advocacy co-director for long COVID physio worldwide. Today, I'm also making a point to everybody who have recovered out of COVID is that our bodies have underwent a jolt, and we have to be very careful in gathering our momentum in life when we are recovering from COVID. The main message which we give out to people who want to return back to exercises is without a very thorough, safe rehab done by specialist long COVID physiotherapist, one should not return back to jogging, running marathons, or doing any kind of high intense activity exercises, which can pose a big risk for a people's body. Now, what is long COVID? Long COVID is something which is a symptom which is showing in people for quite considerable time when a person is recovered, maybe months later of them having had their first bout of COVID. Now, when people have this long COVID, they are often reporting something called as postural orthostatic tachycardia, and they feel a lot of palpitation and a heart which is racing. They might get up in the night feeling their heart is thumping very badly. They might not get sleep. Insomnia is something which is very grossly affecting these people. They have a lot of sleepiness, drowsiness, feeling of cognitive decline, that they're not able to concentrate, and a certain brain fog, certain loss of ability to think, memorize, and remember anything of the past is very common. And they also have a lot of breathlessness and a lot of fatigue and muscle pain. Now, what is the thing which is important is the pain which has come because of COVID related muscle pain shouldn't be treated by physiotherapy modalities like IFT and ultrasound and tractions, dry needling and stuff like that, primarily because we know COVID causes something called as microclotting factors to increase in the blood parameters of a post-COVID body. And also these microclots can form something called as a Rolex formation. They chunk and they collect together, they form a big clot in one of the arteries in the veins, which might travel to the heart or to the brain and cause a stroke or a heart attack. So any kind of vascular deformities in the body, we don't allow all these IFT ultrasound in patients who suffer from these kind of vascular diseases when they have their platelet aggregation factors very elevated or they have INR factors high. People who have heart failures, we do not recommend any kind of therapies which might lead to coagulation of the blood or cause coagulopathy in the parameters of the blood. Most of these long COVID patients have also reported gross reduction in their mineral absorption, which is vitamin D and vitamin B12, because of which the body undergoes a lot of changes metabolically and the bone health is getting affected, whereby many of them also have AV necrosis in the hip. Now, when you have AV necrosis in the hip joint, your blood supply to the hip acetabulum is reduced or is almost impaired. And because of this, there's total ischemia, loss of blood supply, a lot of oxygenation of the tissues around the hip acetabulum, and the person's tissue gets necrosed and it dies off. It might need a total hip replacement for the acetabulum because the bone is dead, because the blood supply is not rich. So many of 80% of the people with COVID have been reported of avian necrosis in the hip joint. So physiotherapists have to be careful of not giving any kind of IFT and ultrasound, dry needling to these patients because the microclots are causing a lot of blood vessel damage, endothelial damage, and might cause clotting in the acetabulum, thereby total necrosis of the healthy tissue also. Even if the tissue was healthy, they're driving it to go ischemic because of the blood clot formation in the acetabulum. Many of them have also reported something called cranial nerve damage and also foot drops. They've talked about Bell's palsy and this GB syndromes and a lot of heart inflammation and a heart valve affection. A lot of them have been having cardiovascular events, particularly because they suffer from a syndrome called postural orthostatic tachycardia. Now, that doesn't mean that somebody is having tachycardia means has POTS. They could be area of symptoms which could be total bloating, feeling of giddiness on standing up, feeling syncope, feeling like falling down when they want to exert a lot, feeling pukish in nature, sweating in nature. They might get up and their heart rate is jumping to 120, 115 on standing up only. If the heart rate is jumping to high level, how a person can actually run a marathon? His actual heart rate, which is the confirmed heart rate, will actually go to a very, very unscientific level, and we might cause that person with a risk uh, to a risk zone where there is a high probability of one getting a heart attack or a cardiac arrest or a stroke. So long COVID is becoming a pandemic or almost like an epidemic, and there are very few clinicians who understand the conditions. Myself have been working on the COVID rehab and the post-COVID rehab and the long COVID rehab since the 2020. And at times, because POTS was a condition which I used to treat prior to the pre-COVID times also. Pre-COVID times, I used to see a lot of Ehlers-Danlos syndrome patients who have POTS. So that would have helped my experience to help post-COVID patients and long COVID patients. Many of the long COVID patients have something called a breathing dysregulation, where they don't know how to breathe well, how to inhale, how to exhale. And if these breathing patterns are not corrected, they bring about a long-term damage to their heart muscles, and thereby they're causing a lot of detrimental effect to the body. So body needs to relearn how to breathe well, and this is what I teach in my pulmonary rehab class and in my long COVID rehab classes, which are mostly done online. As of now, we've been treating so many patients and helping them, mitigate the risk factors associated with long COVID, sitting at home virtually, because many of the clinicians are just sending them back home because their heart results or their cardiac efficiency results, pulmonary efficiency results all come normal. But what they are not able to diagnose them is with POS and breathing dysfunction disorders, a lot of cognitive decline, and a lot of musculoskeletal pains which are coming. These patients are just being sent for random physiotherapy practices, which is causing more harm to the body of a person who's recovered from COVID. This was a short and a sweet message being given by me. I'm Dr. Anjali. One can reach out for my appointments for virtual long COVID and post COVID rehab at 79816 Thank you and stay well and have faith that one can recover out of it if you follow the right practices and follow the right rituals prescribed by the long COVID experts, especially like us, and we'll be there to help you and we are there to help you. Thank you and bye-bye.